Assalamu alaikum. So today we have an article with the name of Impact of Type 2 Diabetic Mellitus in the Occurrence of the Vertical Root Fracture, a case control study. It was published in the GOE by Indian group in 2024. So the aim of this study is to examine the relationship between Type 2 Diabetic Mellitus and the occurrence of the vertical root fracture. For the material and method, they collected patients from 1,400 patients that were examined clinically and radiographically between 2018 and 2022. It was collected from 2 private practices and also the Dental College Hospital, and they included patients that have root canal treatment with full crown restoration. And they excluded teeth with evidence of periapical and periodontal pathology, teeth without full crown restoration, and teeth with root resorption, and teeth with traumatic occlusion, and so on. And they excluded patients with systemic conditions such as hypertension, hypercholesteremia, and renal diseases. And patients with the vertical root fracture and crowned root-filled teeth were considered as a case, and patients without vertical root fracture or periapical or periodontal pathology and crowned root-filled teeth were considered as control teeth. And also they collected the collected number for both group were 132 teeth for the control, and also the same number for the cases group. And also the presence of the vertical root fracture and root canal treated teeth were determined from the clinical sign and symptoms such as the presence of the bucket, sinus tract, banal percussion and palpation, and so on. And they confirm the vertical root fracture by exploratory surgery with the use of a dental operating microscope. And the presence or the absence of pre-existing type 2 diabetic mellitus with hyperglycemia of more than the HbA1c more than 6.5 were noted for the cases and the control group for the past 5 years from the date of the root canal treatment. And they chemically analyzed the root dentine from 5 cases from each group by the Fourier transform infrared spectroscopy to determine the presence of the pentosidine. And this component, pentosidine, increases naturally with age in dentine, and this will lead to a reduction of the mechanical properties of dentine and also reduction of the flexural strength of dentine. For the results, the mean age of patient with the vertical root fracture were 53 years old, and it was male-female with a percentage of 56.8, and the male were 43.2%. And also there was a significant difference in the distribution of the diabetic status between the cases and the control. And it was estimated that patients with diabetic mellitus has higher chance of vertical root fracture by 2.67 times. For the chemical analysis of root dentine, it was found that there was significant increase in the pentosidine level in patients with diabetic mellitus, and this could explain why there was higher chances of vertical root fracture with patients that have diabetic mellitus. So my take from this article is due to the increase of the percentage of the vertical root fracture in diabetic patients, we should try to minimize the size of our preparation in these teeth, and also we should focus in the different method of activation, the ergant activation, to disinfect the root canal in these patients. And all of this just to minimize the chance of the vertical root fracture in these patients. And thank you.